Hey everyone, and welcome back to our channel. Today, we are diving into a crucial topic, autism and public health. Autism Spectrum Disorder, shortly called as ASD, affects millions of people worldwide. Did you know an estimated 1 in 100 children are diagnosed with ASD, and the prevalence is ever rising? Let us explore why autism is a public health concern and how we can create a more inclusive and supportive world for everyone.
Hi doctor, recently I came across the health condition autism. Can you please explain us about it?
Hello? Sure. Autism spectrum disorder is a developmental disability that affects communication and social interaction. Other characteristics are atypical patterns of activities and behaviors.
Doctor, when a child can develop autism? Until which age this condition persists?
Yeah, that's a curious question. ASD usually begins before the age of 3 years and it can last throughout a person's life. Although symptoms may improve over time, some children exhibit signs of ASD within the first 12 months of the life. Others may not show the symptoms until 24 months of age or even later. A definitive diagnosis is sometimes not given to many children until they are considerably older. Some people are not diagnosed until they are adolescents or even adults. People with ASD may not receive the necessary early assistance as a result of this delay.
So, what are the risk factors for the autism?
If we talk about the risk factors, the evidences suggest that having certain genetic and chromosomal conditions, such as a fragile X syndrome or tuberous sclerosis, then birth complications, the children who are born to older parents, any kind of infection to a mother during a pregnancy, which are often known as maternal infection, they can be the risk factors for autism.
Doctor, so how will I be able to know if a child has autism? What are the signs and symptoms of autism?
I will be telling you some of the critical signs and symptoms, which are as follows. You may notice poor social communication and interaction skills. For example, you can see that the child avoids eye contact. The child might not give any response after naming him even by the age of 9 months of age. You can notice limited or no gestures by 12 months of age. The child does not show you something interesting by the age of 18 months. You may also notice that your child does not notice other children much and even take time to mingle with them or join them in play as long as 36 months of age. You may notice restricted or repetitive behaviors or interests like enjoys placing things in a proper order and gets upset if you change the order. The child may repeat the words or phrases again and again. You may also notice that the child plays with the toys in the same manner every time he plays with them. There could be flapping of hands that is visible. And usually a normal child reacts to a specific sound, smell or taste in a normal manner. This child, you will see, reacts to sounds, smell, tastes, looks in a very weird manner, and you can find that it is strange. I'm not saying it's abnormal, but yeah, it is different from regular children. And other characteristics may include delayed learning skills, language skills, movement skills. You may see impulsive behavior, unusual eating and sleeping habits. Sometimes you can see there is lack of fear to a lot of things, and sometimes it is extreme amount of fear which is very much more than expected. Remember, your child should undergo developmental and behavioral screening during the regular visits at the age of 9 months, 18 months and 30 months. Additionally, it is recommended that the child must be screened particularly for ASD at the age of 18 months and 24 months. I hope I have answered to your question.
Yes, doctor. But I also want to know if there are any preventive measures to prevent autism.
See, just like any other thing, there is nothing that it cannot be done to prevent anything. So even for the autism, research have demonstrated that preventative benefits of timely breastfeeding, limiting exposure to the dangerous chemicals, pollutants and drugs, and taking dietary supplements like vitamin D and folate, which are very important during pregnancy, avoiding smoking and drinking, having proper prenatal checkups can prove to be useful. But remember, it is not just that during the pregnancy the mother can come in contact with all those things. It's usually recommended that a healthy pattern of lifestyle should be adopted so that eventually at any stage if the mother conceives, the child is at a lower risk of developing ASD.
Thank you, doctor.
Hello viewers, just to conclude, always remember, contact your doctors and your child's doctor if you think your child might have an ASD or if you have any other concerns about the way your child plays, learns, speaks, acts or behaves. Higher rates of mental health problems, physical health disorders and unmet healthcare demands are seen in individuals with autism. Stigma and discrimination will only further complicate the child. It also significantly impacts an individual's quality of life as it can impact their education, employment, and developing relationships. So, educate yourself on autism and together we can make an inclusive world where all the people with autism can have a fulfilling life and even a more efficient one. Thank you for joining us. Please don't forget to like, share and subscribe to our channel.